Hey, good morning, everyone, and welcome to the UroPatient podcast. I'm your host, Vic Sinise, and welcome to the show. We come to you live every Saturday at 10:30 a.m. Central Time over YouTube and Facebook. Um, if you haven't checked out our website at UroPatient.com, it is the best place to go to catch all of our past episodes. Recommend you check that one out. Also, it's the best place to get handouts. We create a handout every time we put out a new show. So there's some good information for you on our website. Always download our handouts. They're free. Today, I'm going to be talking to you about BCG treatments for bladder cancer. A couple weeks ago, we talked about bladder cancer, and it was one of our more popular episodes. All right, so we'll go ahead and get going on our discussion on that. So the story of the BCG or Bacillus Calmette-Guérin comes from its origin as a vaccine for tuberculosis. Now, it gets its name from Albert Calmette and Camille Guérin, who were a couple of French bacteriologists who developed the vaccine in the 20th century. They derived it from a strain of bacterium from cattle. It was the one that caused TB in cattle. And their goal was to create a vaccine that could protect against TB, a highly contagious and often deadly disease. So BC vaccination is often a part of childhood vaccination scheduled in many countries with high rates of TB. So there still are countries that have those high rates. While BCG is not widely used in countries with low TB rates, such as the US, it may be recommended for certain individuals with higher risk of TB infection, such as healthcare workers and those living in close contact with individuals who have active TB. The roots of BCG therapy for bladder cancer can be traced to the mid-20th century, when researchers noted that individuals with both tuberculosis and bladder cancer seemed to have better outcomes with their bladder cancer. It was kind of that light bulb moment that sparked interest in exploring whether the BCG vaccine, originally developed for TB, could have therapeutic effects beyond its intended use. And it's often how we find medications by secondary uses. So in the 70s, researchers discovered BCG's potential to induce an immune response against cancer cells, specifically bladder cancer. Clinical trials demonstrated that BCG therapy could significantly reduce the recurrence and progression of early-stage bladder cancer. The exact mechanism of action of BCG therapy in bladder cancer is not fully understood, but it's believed to involve both local and systemic immune responses. BCG basically activates the immune cells within the bladder to target and eliminate bladder cancer. So how is it done? What's the procedure? So you come to the office. It's an office procedure. Typically, it's going to be done by the urology nurse working in the office. First thing you'll have to do is give a urine sample so we can test your urine. We have to make sure you don't have an infection, because that's very important. If you had an infection in your urine and got a BCG treatment, there's a higher risk you could absorb the BCG through the bladder wall and become sick. So that's one of the things that we can do to help avoid that from happening. Now, urine test is fine. Then the next thing we're going to do is place a catheter. We always like to make this as easy as we can. So we use a numbing agent. You see one here on the picture there in the slide called Glido. It's a lubricant. There's no needle. We just squirt it in. It numbs up the urethral tract. Then we can place that catheter nice and easily. So it's not really a big deal. Once the catheter is in place, we drain the bladder, and then we're going to go and drip the BCG into the bladder slowly. It's usually takes anywhere from 3 to 5 minutes to put all this medicine in your bladder. Once it's dripped in, its catheter can be removed. And it's kind of like what you see in this picture here. So it's definitely dripping enough of a closed container. Now, some people worry, how am I going to hold this medicine in my bladder? And how much are you putting in my bladder? Well, it's a very small amount. It's actually 50 cc's, and a shot glass is 30 cc's. So 2 of those shot glasses are bigger than the amount of BCG that's put in your bladder, easily for most people to hold. Then you go home. That's it. You're done in the office. And the rest of it, you're going to take care of at home. Now, here's what you need to do. Once you get home, you're going to mark down when you got that medicine, and you want to leave it in your bladder for 2 hours, not 3 hours, not less. If you can't make it to the 2 hours, well, that's fine. Just let us know at your next treatment. But don't keep it in longer, because that can actually cause more side effects, not better therapeutic results. You should remain active. You don't want to just lay in one spot or sit in a chair watching TV. You want to move around so that that medicine can coat the entire bladder. So you want to get it moving around the bladder. So if you can't move around a lot and you're kind of more of a lying in state, then make sure you're turning, back to front every 15 minutes so the medicine gets a chance to slosh around. Now, after the 2 hours, you're going to go ahead and urinate it out into the toilet. We recommend that men and women both sit to urinate so that you fully empty your bladder and that you don't splash the BCG as it's coming out. Again, that still has the bacteria BCG in there. And because of that, we do want to treat it before you go flushing the toilet. Now, what you need to do is pour 2 cups of household bleach into the toilet, and then close the lid. If you got a vent fan in your bathroom, turn that on, but make sure you close the lid. Chlorine will release, or the bleach is chlorine, and it'll release a lot of that smell in the area, and it can actually be irritating to your respiratory system. So you don't want to be breathing in a whole bunch of bleach. So, and 2 cups is a fair amount that you pour in there. So close the lid, ventilate it. That's always a good idea. Now you're going to leave that bleach in the toilet for about 15 to 20 minutes, and then you can go ahead and flush it. And you're going to do that treatment, that same routine with the 2 cups of bleach every time you urinate for 6 hours after the treatment. So once you started that first urination, the next 6 hours, you're going to treat all the urine. After that, it's perfectly safe. Wash your hands and genitals thoroughly after you urinate, and then drink plenty of fluids after you've urinated to keep flushing that out of your bladder. So you want to give yourself plenty of urine to help flush out anything from your bladder. Now, how often do you get the treatment? Well, it's once a week, and typically the routine is once a week for 6 weeks, 6 weekly treatments. And if you wondered why it's 6 weekly treatments, why not 5? Why not 4? Well, I was actually involved in the early studies with BCG, and before it was FDA approved, and we got the medications to start patients in our office on it. And the one thing that I asked was why it was 6. And they said, pretty simple. It comes in a 6-pack. So that's why it was 6 treatments. Now, interestingly, that's kind of randomly how it got picked to be 6 treatments, but they've done studies looking at lesser treatments, more treatments, and have found that 6 seems to be the sweet spot. So sometimes you just guess right, I guess. Now, afterwards, you may experience some burning and frequency of urination for the first few voids after your treatment. Perfectly normal, nothing to get worried about. I always say that if you remember, we're trying to cause an immune response in your bladder. So it's going to cause it to get kind of irritated. And if you have that reaction, that's pretty normal. It's just like as if the body was fighting a urinary tract infection. That's what it's doing when it's trying to fight the BCG. So, and you may not notice it the first time you get your treatment. Maybe the first one and the second one are pretty easy. Then about the third and the following ones, you'll notice that burning and frequency a little more because now your bladder recognizes it. That means your immune system is really keying in on that. That's what we want. That's good. But there are some symptoms that we get more worried about. So if you were to have bright red blood, clots in the toilet, when you're urinating, those type of things, let us know. If this urination, burning and stuff is so severe that you can't tolerate it, again, give us a call. There's things that we can try to do. Now, those are just more aggravating things, not necessarily serious, but seriously, this is pretty rare. I actually wouldn't say pretty rare. This is very rare. I've only seen it, I think, once or twice in my career. And again, I was involved in a lot of BCG administration, but it's something called BCG sepsis. So remember, it's a live bacteria that's being put into the bladder. And if it gets absorbed into the bloodstream, bacteria in the bloodstream is something called sepsis, and they call this BCG sepsis. So if it does travel and get into the bloodstream, then there is that risk that you could become severely sick. You'll know you're going to be really sick, like you got the worst flu of your life. Fever, chills, high fevers, 101, 102, stomach pain, vomiting, nausea, any of those symptoms, you call us right away because we're going to tell you what to do. Now, fortunately, it's just treated with antibiotics. But again, we want to get that antibiotic going sooner than later. So that's the only thing you really need to be worried about. And again, I can tell you it's very rare, especially if you follow all the precautions that I just told you about, such things as, we check having your urine checked, there's no infection, not keeping the medicine longer than you should. So you can get through this just fine. And remember, go to our website. I do have that handout for you. It has everything that we've talked about in this, video, so it's there available. Download it. That's what it's for. So with that, I finished with the episode, and I think that we got some good information. I know the bladder cancer was a pretty popular episode, so I think finding out what you need to do afterwards is going to be great. So this is how we would treat it with medication. We only use BCG if the bladder cancer keeps coming back, and we'll prevent it from progressing and recurring. That's the whole key. So until next week, have a great day, and we'll see you next week on the UroPatient podcast.